Are you waking up at night with sharp leg cramps? Or maybe you're standing too long and suddenly feel that seizing tension in your calves or feet? If you're over 50, or even just highly stressed or depleted, you might be missing just 3 critical vitamins. And it's not about popping painkillers or stretching more. The issue starts much deeper inside your cells. So let's break it down. Magnesium is one of the most underappreciated yet essential minerals in the human body, especially as we age. It's often referred to as the relaxation mineral because it plays a central role in calming both the nervous system and muscle tissue. Every single cell in your body needs magnesium to function, but it's particularly vital for muscles, nerves, and energy production. When magnesium levels drop, even slightly, your muscles can begin to misfire, leading to cramps, spasms, stiffness, and an overall sense of fatigue. Most people don't realize that over 300 enzymatic reactions depend on magnesium, including the production of ATP, which is your body's cellular energy currency. Without enough ATP, your muscle fibers don't have the energy to relax properly after contraction, which is why magnesium deficiency often manifests as tightness, twitching, or sudden night cramps in the calves, feet, and thighs. Seniors are especially at risk due to decreased digestive efficiency, increased medication use such as diuretics and proton pump inhibitors, and natural losses in renal magnesium conservation. Moreover, chronic stress, which is common in older adults and caregivers, depletes magnesium rapidly as the body uses more of it during heightened states of cortisol-driven response. The more stressed you are, the more magnesium you burn, and this leads to a vicious cycle where the depletion worsens your stress response and leads to insomnia, anxiety, or irritability. What's even more concerning is that magnesium doesn't just operate in isolation. It works synergistically with calcium, potassium, sodium, and vitamin D. If magnesium is low, calcium floods the cells excessively, leading to overcontraction of muscles and nerves, and eventually cramping or even arrhythmias. You might take in enough calcium through diet or supplements, but without adequate magnesium to balance it, that calcium becomes more of a liability than a benefit. Magnesium is also required for the conversion of vitamin D into its active form, meaning if your magnesium is low, your vitamin D therapy may not even be working effectively. The common symptoms that often drive people to seek medical attention, restless legs, tight hamstrings, eye twitches, stiff neck, clenched jaws, or even chronic constipation, are classic signs of magnesium deficiency, yet rarely addressed in clinical settings. People tend to reach for pain medications, muscle relaxers, or electrolyte drinks filled with sugar and sodium, missing the root cause completely. To make things more complicated, magnesium is not stored in high amounts in the body and needs to be replenished daily, either through diet or supplementation. Yet our modern soil is depleted of magnesium due to overfarming and lack of mineral-rich composting, so even whole foods like vegetables may not contain the levels they did 50 years ago. Magnesium-rich foods include dark leafy greens, pumpkin seeds, almonds, avocados, and certain types of fish like mackerel and salmon. But many seniors don't eat enough of these foods regularly. Combine that with absorption issues such as low stomach acid, leaky gut, or medications that interfere with magnesium uptake, and it's easy to see why so many people fall into a chronic deficiency without realizing it. The bioavailability of magnesium also matters. Not all forms are created equal. Magnesium oxide, found in most multivitamins, is poorly absorbed, whereas magnesium glycinate, citrate, malate, or chloride tend to have much higher absorption and better tolerance. Glycinate, for example, is calming for the nervous system, while malate supports energy production and muscle endurance, making them both excellent choices for seniors or anyone experiencing cramps or fatigue. People with insulin resistance or type 2 diabetes are particularly vulnerable to magnesium loss because high insulin levels cause magnesium to be excreted through the kidneys. As insulin resistance worsens, which is common with aging and high carbohydrate diets, so does magnesium deficiency, which in turn makes the insulin resistance even harder to reverse. Magnesium also plays a key role in blood pressure regulation and heart rhythm. Low magnesium contributes to hypertension, atrial fibrillation. In fact, some hospitals use intravenous magnesium to treat emergency heart arrhythmias or eclampsia in pregnant women because it has such a potent calming and stabilizing effect on muscle tissue. Magnesium deficiency can also mimic or worsen depression, as the mineral is crucial for serotonin receptor function in the brain. It's not uncommon for people who are anxious, moody, or mentally foggy to discover that their symptoms improve significantly with proper magnesium intake. Supplementing magnesium should always be done gradually, starting with small doses and monitoring for tolerance, especially if digestion is sluggish. Excessive oral magnesium can cause loose stools, which is often an indicator of reaching bowel tolerance rather than toxicity. This mineral should never be underestimated for those seeking to support their muscular function, nerve signaling, stress resilience, sleep quality, or energy metabolism, especially as the aging process naturally depletes many of the body's vital nutrient reserves. Vitamin B1, also known as thiamine, is one of the most foundational nutrients for energy metabolism, nerve function, and muscular coordination. Yet, it is among the most commonly overlooked in adults over 60. Thiamine plays a central role in converting the carbohydrates you eat into usable energy at the cellular level, specifically through its involvement in the Krebs cycle and the production of ATP. When thiamine levels are low, the mitochondria, the energy factories of your cells, struggle to process fuel efficiently, leading to chronic fatigue, sluggish reflexes, leg weakness, and even muscle cramping. The connection between thiamine and nerve conduction is especially critical. Your nervous system relies on thiamine-dependent enzymes to generate the proper electrical signals that travel from the spine to the extremities. When this system is compromised, the legs often become the first area to show symptoms like tingling, burning, numbness, or sharp shooting pains, sensations often misattributed to poor circulation or aging alone. Seniors are particularly vulnerable to thiamine deficiency due to several factors. Reduced stomach acid impairs nutrient absorption, a diet lower in whole foods, and a higher dependency on medications like diuretics, antacids, and blood pressure pills that strip thiamine from the body. In fact, even a moderate daily intake of alcohol, even in cooking, can significantly interfere with thiamine absorption, and long-term use of metformin or certain antibiotics also compounds the problem by depleting this critical B vitamin further. Thiamine also plays a major role in cardiovascular function. Deficiency can lead to symptoms such as low blood pressure, irregular heartbeat, and even shortness of breath with mild activity. What's more, when thiamine is lacking, the body struggles to regulate fluid balance properly. The sodium-potassium pumps in your cells begin to malfunction, leading to signs like swelling in the feet, poor lymphatic drainage, heaviness in the legs, and even puffy ankles, symptoms that often get wrongly blamed on sodium or simple aging when the real culprit is cellular energy failure. Many seniors experience this gradual decline without ever realizing it has a nutritional basis. Thiamine is also vital for maintaining balance, stability, and coordination. In cases of deficiency, older adults may feel dizzy when standing up, experience slow reflexes, or have difficulty lifting the legs properly while walking, sometimes described as a dragging or shuffling gait. These are neurological warning signs that the communication between brain and body is fraying due to inadequate B1 levels. The problem is compounded by the fact that thiamine is a water-soluble vitamin that must be consumed daily. The body doesn't store it in large quantities, so going even a few days without optimal intake can lead to noticeable consequences, especially if the person is already under physiological stress. Chronic inflammation, high carbohydrate intake, emotional stress, or physical injury all increase thiamine demand, meaning that someone can be eating enough by general standards, but still come up short when their body is under strain. Thiamine is also a cofactor in the production of acetylcholine, the neurotransmitter responsible for muscle contraction, memory, and focus. When acetylcholine production drops, not only do muscles become less responsive, but mental clarity suffers as well, often mimicking early signs of cognitive decline or dementia. This makes B1 one of the most important nutrients for both mind and muscle. Additionally, many people mistakenly believe they are getting enough B1 from fortified grains or cereals, not realizing that synthetic forms like thiamine mononitrate are less bioavailable, especially in older adults with impaired digestion. Whole food sources of B1 include pork, sunflower seeds, legumes, organ meats, and seaweed. But most modern diets fall short of including these regularly, especially in processed or low-protein eating patterns. To make matters worse, high sugar and refined carb consumption depletes thiamine rapidly because every molecule of glucose requires thiamine to be metabolized. This is why people with prediabetes, diabetes, or metabolic syndrome are often in a chronic state of B1 deficiency, which feeds back into symptoms like leg pain, cramps, fatigue, and blood sugar instability. Even coffee and tea can interfere with thiamine absorption due to compounds called tannins and caffeine's diuretic effect. Supplementing with thiamine can be life-changing, especially when using bioavailable forms like thiamine HCl or benfotiamine, the latter being fat-soluble and better at reaching nerve tissues. Clinical improvements are often seen within days when dosing is adequate and consistent. Many functional medicine practitioners recommend higher doses initially, sometimes 100 mg or more per day, especially in cases of chronic fatigue, diabetic neuropathy, or fibromyalgia. It is also essential to pair thiamine with other B-complex vitamins, particularly B2, B3, and B6, as they work synergistically in energy metabolism. Without this broader support, thiamine's effects may be muted or create temporary imbalances, while deficiency symptoms can mimic dozens of other issues, from depression to arthritis to adrenal fatigue. Restoring thiamine status can rapidly improve muscle strength, nerve function, fluid balance, and overall vitality. Vitamin D is not just a vitamin, it's more like a hormone that controls hundreds of processes throughout the body. And when it comes to leg cramps, muscle weakness, and overall physical resilience in seniors, it is absolutely essential. Most people know it for its role in calcium absorption and bone health, but far fewer understand how it controls the strength and coordination of your muscles, the balance of minerals like magnesium and potassium, and even the excitability of your nerve cells. Low vitamin D can lead to weak, painful legs, unstable joints, frequent muscle spasms, and cramping that seems to appear out of nowhere. The motor neurons, those responsible for sending electrical impulses to your muscles, are lined with vitamin D receptors, meaning that when you're deficient, the muscles receive weaker signals, they misfire, or they overcontract. This can show up as random twitching, burning legs at night, a feeling of heaviness in the thighs, or a tendency for the calves to seize up after short walks or standing for long periods. Seniors are at particularly high risk of vitamin D deficiency because the body's ability to convert sunlight into vitamin D declines sharply with age. A 7-year-old makes about 25% of the vitamin D that a 20-year-old can under the same sun exposure. Add to that the fact that most older adults avoid direct sunlight, wear sunscreen, or are housebound, and the result is widespread deficiency that often goes undetected because the symptoms are attributed to aging or circulatory issues. And while blood tests may show normal levels, what's considered normal is often based on outdated lab ranges that don't reflect optimal function. Most functional health experts recommend serum levels between 50-80 and /ml for full systemic benefit, yet many seniors hover around 20 or 30, which is far too low to maintain muscular integrity and nerve health. Vitamin D also plays a direct role in calcium utilization. Without adequate D, calcium gets deposited into soft tissues instead of bones and muscles, contributing to stiffness, arterial plaque, and mineral imbalances that show up as cramps, tingling, or numbness in the legs and feet. In fact, leg cramps can often result from improper calcium placement due to insufficient D levels, not necessarily from a calcium shortage itself. Even more interesting is how vitamin D impacts magnesium metabolism. Magnesium is required to convert vitamin D into its active form in the kidneys and liver, and active vitamin D in turn helps retain magnesium inside the cells. When vitamin D is low, magnesium gets wasted through the urine, leading to an intracellular deficiency, and this is often the root cause of nighttime leg cramps and restless legs syndrome. So when vitamin D is low, magnesium becomes low, calcium becomes mismanaged, and the entire muscular system suffers the consequences. You can't focus. Furthermore, vitamin D has a regulatory effect on inflammation. It suppresses cytokines and immune molecules that lead to swelling in the joints, stiffness in the hips, and pain in the knees and legs, especially first thing in the morning or after long periods of inactivity. Many seniors mistake these symptoms for arthritis or poor circulation, when in fact they're systemic inflammatory reactions fueled by insufficient vitamin D. Even blood pressure and circulation are influenced by vitamin D levels, since the vitamin interacts with the renin-angiotensin-aldosterone system, the hormone network that controls fluid retention, vascular tension, and sodium balance. When D levels are low, the body tends to retain more fluid, the legs feel swollen, ankles get puffy, and capillary circulation becomes compromised. This is one of the overlooked contributors to the sensation of heavy legs and poor oxygen delivery to the extremities. Vitamin D also supports mitochondrial health by promoting the expression of genes involved in oxidative phosphorylation, the process by which your cells convert nutrients into usable energy. Without adequate vitamin D, the mitochondria produce less ATP, which is the basic energy currency your muscles need to contract and relax efficiently. This is why people who are vitamin D deficient often feel fatigued, unable to walk long distances, or report that their legs feel like lead after even simple tasks like climbing stairs. It's not just physical tiredness, it's cellular energy collapse. Many medications commonly used by older adults also interfere with vitamin D absorption or metabolism. Statins, steroids, certain diuretics, and anti-seizure drugs are all known to lower vitamin D levels, making it even more important to be aware of your baseline and compensate accordingly. And dietary sources of vitamin D are limited. Fatty fish, egg yolks, and cod liver oil offer modest amounts, but not enough to correct a deficiency. Supplementation with vitamin D3, ideally combined with K2, to direct calcium properly into the bones, is often necessary to restore balance and reduce symptoms. Dosing varies by individual, but many people over 60 require anywhere from 2,000 to 5,000 IU daily to maintain optimal function, especially during the winter months or in northern latitudes where sun exposure is limited. And without adequate dietary fat, absorption drops dramatically because vitamin D is fat soluble, meaning that taking it with meals rich in healthy fats like avocado, olive oil, or grass-fed butter greatly enhances bioavailability. A strong foundation of vitamin D is not just about avoiding rickets or weak bones. It is a cornerstone of muscular strength, nerve function, electrolyte balance, and energy resilience that becomes even more crucial as the body ages. Electrolyte imbalance is one of the most overlooked yet foundational disruptions in the human body, especially as we age, and it plays a central role in everything from muscle cramps, fatigue, brain fog, irregular heartbeat, to swelling in the legs and ankles. Electrolytes, sodium, potassium, magnesium, calcium, chloride, and phosphate, are charged minerals that control electrical activity in your body. Every heartbeat, every nerve signal, every muscle contraction, and every time your kidneys filter blood or your digestive system breaks down nutrients, electrolytes are involved. Without the right balance, the body essentially loses its ability to communicate with itself. This isn't just a minor imbalance you can ignore. When your electrolyte levels shift even slightly, cells can become hyperactive, misfire, or even stop functioning entirely. Muscle fibers cramp, nerves become hypersensitive or sluggish, and the delicate relationship between hydration and mineral balance collapses, leading to swelling, edema, or systemic dehydration at the cellular level, even if you're drinking plenty of water. It's not just about hydration, it's about absorption, retention, and distribution of fluid within and between cells. Seniors in particular are prone to electrolyte imbalance due to declining kidney function, medications like diuretics and blood pressure pills, and reduced stomach acid, which impairs mineral absorption. As kidney efficiency declines with age, the regulation of sodium and potassium becomes compromised, which can raise blood pressure or cause severe fatigue because cells can't maintain proper electrical gradients. And when those minerals are flushed out faster than they're replenished, either due to poor diet, excess caffeine, alcohol, chronic stress, or sweating, the nervous system begins to falter. People often describe sensations like pins and needles, heavy legs, or numbness in their feet without realizing these are neurological symptoms stemming from poor electrolyte function. Magnesium, for instance, controls over 300 enzymatic processes in the body, including how muscles relax after contraction. When magnesium is low, muscles seize up, cramps occur, heart rhythms go erratic, and sleep becomes fragmented. Potassium, another critical electrolyte, works hand in hand with sodium to regulate water balance inside and outside of cells. When potassium drops, sodium takes over, pulling water into extracellular spaces, which leads to bloating, puffiness, and swelling in the lower legs or face. This is why high-sodium diets that lack potassium-rich foods like leafy greens, avocados, or coconut water often cause water retention, especially in older adults. Calcium, while often associated with bones, is also an electrolyte that controls muscle contraction. But when calcium is imbalanced in relation to magnesium or phosphorus, it can deposit into soft tissues instead of being directed to bones, contributing to stiffness, arthritis, or even vascular calcification. As what many don't realize is that vitamin D, parathyroid function, and kidney health all influence how calcium behaves, and any deficiency in those systems can throw off electrolyte dynamics entirely. Even mild dehydration without proper electrolyte replenishment can be dangerous. Drinking plain water in large quantities without replacing electrolytes actually dilutes the mineral content in your blood and can lead to something called hyponatremia, low sodium concentration, which causes brain swelling, nausea, confusion, and in extreme cases, coma. Athletes know this, but seniors are rarely warned. The thirst response also weakens with age, which means by the time you feel thirsty, you're already mildly dehydrated. Yet many seniors are told to drink more water without being told to pair it with minerals. And when mineral intake is insufficient due to processed food diets or poor digestion, symptoms begin to stack up. Fatigue, dizziness when standing, brain fog, irritability, heart palpitations, and temperature regulation issues. These are not random signs of aging. They are electrical problems at the cellular level. Additionally, blood sugar swings from poor diet or insulin resistance can further disturb electrolyte balance, as insulin helps usher potassium into cells. Without this function, potassium builds up in the blood and creates further imbalance, making it difficult for muscles to relax, increasing the risk of cramping. And impairing cardiac function. Cortisol, your stress hormone, also causes sodium retention and potassium loss, which is why chronic stress often leads to high blood pressure, swelling in the ankles, and tightness in the chest. Most people think of electrolytes as something athletes need to replenish after sweating, but the truth is far more fundamental. Every biological system in your body, from your heartbeat to your hormones, from digestion to detoxification, is regulated by the constant push and pull of these minerals. And when one mineral shifts out of range, the others often follow in a cascade effect. It becomes a domino chain that affects pH balance, nervous system coordination, muscle performance, even your ability to sleep deeply or feel mentally sharp. When electrolytes are balanced, everything works. Cells communicate, inflammation reduces, energy improves, hydration is efficient, and even mood and cognitive function become more stable. But when they're out of balance, you feel it everywhere, even if your doctor says your labs look fine. Because standard blood panels often don't reflect intracellular mineral levels, you could have normal serum potassium and still be functionally deficient at the tissue level. The body protects the blood at all costs, even pulling minerals from cells, bones, and organs to keep blood levels normal, while the tissues suffer silently in the background. When you're dealing with persistent symptoms like leg cramps, joint pain, bloating, fatigue, or brain fog, your natural instinct is to reach for something that gives fast relief. And that's important, especially when discomfort interrupts sleep, mobility, or basic daily tasks. But here's the catch. Fast relief without long-term repair is like turning off the fire alarm while the building keeps burning. You might silence the symptom, but the root cause continues to develop quietly in the background. True healing, especially for those over 50, requires a dual approach: immediate support for symptoms and deep cellular level repair over time. Let's take leg cramps, for example. You may feel sudden tightness in the calves, pulling in the toes, or sharp spasms at night. Magnesium citrate can offer quick relief because it absorbs rapidly, relaxes smooth muscle fibers, and helps balance nerve impulses. But if your magnesium deficiency is chronic due to poor diet, stress, or medications like diuretics, then those cramps will keep coming back. This is where long-term repair comes in. Building magnesium reserves through regular intake of leafy greens, nuts, seeds, and possibly supplementation of slower absorbing forms like magnesium glycinate. You start with fast action, but follow it up with consistent replenishment to correct the underlying mineral imbalance. This same principle applies to blood sugar crashes, mood swings, or sudden fatigue. A quick fix might look like a handful of berries or a spoonful of MCT oil to raise energy and stabilize the brain. But if your insulin sensitivity is off due to decades of high carb eating or stress-induced cortisol spikes, then you need to rebuild mitochondrial efficiency, improve fat adaptation, and retrain your metabolic pathways through fasting, targeted nutrition, and key nutrients like chromium, alpha-lipoic acid, and B vitamins. So yes, take the MCT oil when you feel weak, but don't stop there. Dig into why your metabolism keeps hitting those lows and start a protocol that rewires your body to burn fat more cleanly, reducing those dips altogether. Joint pain is another great example. Let's say your knees ache when you wake up or after walking. A turmeric ginger combo with black pepper can reduce inflammation within an hour because it blocks COX-2 enzymes and reduces oxidative stress in synovial tissues. That's fast relief. But what about the cartilage degeneration, the mineral imbalance, or the leaky gut driving systemic inflammation? Long-term repair means supporting collagen synthesis with vitamin C, zinc, proline, and glycine. It means improving gut barrier integrity through glutamine and fermented foods. It means cutting out seed oils and sugar to stop chronic inflammation at its source. Most people stop at turmeric and miss the bigger opportunity to rebuild their joints from the inside out. The gut is another system that craves this two-pronged approach. You might feel bloated, gassy, or uncomfortable after meals. Digestive enzymes or betaine HCl can offer immediate relief by helping your body break down food more efficiently. But if low stomach acid, gallbladder sluggishness, or bacterial overgrowth are at play, you need to go deeper. You need to retrain your digestive cascade, starting with hydration, mindful eating, restoring bile flow with bitter herbs, and repairing gut lining with nutrients like zinc carnosine and slippery elm. This is repair at the root. And it doesn't come in one pill. It's a lifestyle process. When it comes to the nervous system, things like anxiety, heart palpitations, or poor sleep, the same pattern holds. A calming magnesium or a GABA-supporting tea may ease symptoms quickly, but lasting peace comes from addressing adrenal fatigue, balancing blood sugar, getting morning sunlight, and recalibrating your circadian rhythm over weeks and months. Your nervous system doesn't just need to be quieted, it needs to be retrained. One of the most powerful places this dual strategy applies is in aging skin and tissue tone. You might use collagen powder or a topical cream and see some improvement. That's short-term support. But real skin renewal comes from reducing glycation, protecting mitochondrial DNA, rebuilding hormonal balance, and supporting elastin with silica, MSM, and omega-3s. The skin reflects what's going on beneath. If you want lasting change, you need to go to the layer before the symptom. And this applies even more to weight loss after 60. Fast relief might come from cutting carbs for a week or doing a 16-hour fast. You'll lose some water weight, reduce bloating, and feel lighter. But sustainable fat loss depends on AMPK activation, mitochondrial health, and improving metabolic flexibility through strategic nutrient timing, stress reduction, and micronutrient repletion. The goal isn't just a number on a scale. It's remodeling how your cells produce energy, how your body responds to insulin, and how your hormones coordinate hunger and satiety. When the body receives both immediate support and long-term instruction, it no longer lives in crisis mode. It begins to repair, regulate, and restore its natural intelligence. You shift from managing symptoms to transforming your health blueprint at the cellular level.